In this section, I'm going to give an overview of therapies available to those with bipolar disorder. Medications, including mood stabilizers, antidepressants, and antipsychotics, can help reduce symptoms and are recommended as the first-line treatment for the disorder. I'm going to talk about medication in depth in Part 7 of this series. In addition to medication, people can learn to manage their symptoms and improve their functioning with psychosocial treatment and rehabilitation. The treatments I'll cover are considered to be evidence-based practices. This means that they're treatments which research has shown to be effective for people with bipolar disorder. The first treatment I want to talk about is psychoeducation. Psychoeducation provides patients with an understanding of their illness and the most effective ways of treating symptoms and preventing relapse. Psychoeducation covers topics such as the nature and course of bipolar disorder, the importance of active involvement in treatment, the potential benefits and adverse effects of various treatment options, identification of early warning signs of relapse, and behavior changes that reduce the likelihood of relapse. Next, let's talk about cognitive behavioral therapy, or CBT for bipolar disorder. CBT is a blend of two therapies, cognitive therapy and behavioral therapy. Cognitive therapy focuses on a person's thoughts and beliefs and how they influence a person's mood and actions. CBT aims to change a person's way of thinking to be more adaptive and healthy. Behavioral therapy focuses on a person's actions and aims to change unhealthy behavior patterns. CBT includes psychoeducation about the disorder, as well as problem-solving techniques. Individuals learn to identify what triggers episodes of the illness, which can reduce the chances of relapse. This can help them minimize the types of stress that can lead to a hospitalization. CBT also helps people learn how to identify problematic thoughts, logically challenge them, and replace them with healthy thoughts. CBT further targets depressive symptoms by encouraging people to schedule pleasurable activities. CBT may be done one-on-one or in a group setting. The next intervention I want to cover is interpersonal and social rhythm therapy. In interpersonal and social rhythm therapy, people first learn to recognize that their sleep and wake cycles, their daily routines, and their mental health symptoms are all connected. The treatment then focuses on developing a daily routine in regards to sleep, diet, exercise, and other activities, and addresses potential problems that may disrupt these routines. This often means dealing with current relationship problems with friends, family members, and others, and also developing strategies to prevent such problems from happening again. When combined with medication, this treatment can help people meet their goals in improving their daily routine and reduce both depressive and manic symptoms. Let's move on to family treatment and psychoeducation, which is a way for families to work together toward recovery. In family-based services, families attend educational sessions where they will learn basic facts about mental illness, coping skills, communication skills, problem-solving skills, and ways to work with one another toward recovery. People who participate in family services, along with taking medication, have fewer relapses, longer time between relapses, better medication adherence, less severe mood symptoms, and increased positive communication between family members. There are a range of family programs available. Some families benefit from just a few sessions, and other families benefit from more intensive interventions. More intensive services are especially helpful for families that are experiencing high levels of stress and tension, and for people who constantly have symptoms or are prone to relapse. These longer-term interventions generally last 6 to 9 months and can be done either in a single family format or a multifamily format. Let's move on to social skills training, or SST. Many people with bipolar disorder have difficulties with effective social skills. Social skills training aims to correct these deficits by teaching socially appropriate ways to express emotion and communicate more effectively, so that individuals are more likely to achieve their goals, develop relationships, and live independently. Social skills are taught using behavioral techniques such as modeling, role-playing, and positive reinforcement. Let's talk about illness self-management next. This treatment combines several other therapies into one package. Components of illness self-management include psychoeducation, coping skills training, relapse prevention, and social skills training. Individuals learn about their psychiatric illness, their treatment choices, medication adherence strategies, and coping skills to deal with stress and symptoms. Relapse prevention involves recognizing situations that might trigger symptoms and tracking warning signs and symptoms of relapse. It also involves developing a plan to cope with these triggers and warning signs. This treatment approach also teaches social skills in order to improve the quality of relationships with others. The next intervention I want to talk about is assertive community treatment. Assertive community treatment, or ACT, is an approach that is most effective for individuals with the greatest service needs, such as those with a history of multiple hospitalizations or those who are homeless. In ACT, the person receives treatment from an interdisciplinary team of usually 10 to 12 professionals, including case managers, a psychiatrist, several nurses and social workers, work specialists, substance abuse treatment providers, and peer specialists. The team provides coverage 24 hours a day, 7 days per week, and has small caseloads, usually one staff for every 10 people. Services provided include case management, comprehensive treatment planning, crisis intervention, medication management, individual supportive therapy, substance abuse treatment, rehabilitation services such as supported employment, and peer services. So it's really comprehensive. The Veterans Administration has a version of this program as well. At the VA, this intervention is called Mental Health Intensive Case Management, or more commonly known as MICM. Let's touch on alcohol and drug use next, because many individuals with bipolar disorder also struggle with an alcohol or substance use disorder. This is called co-occurring disorders or dual diagnosis. Co-occurring disorders are best treated concurrently, meaning that treatment for bipolar disorder should be integrated with the treatment for the alcohol or drug problem. Integrated treatments include cognitive behavioral interventions and motivational enhancement, which is designed to increase motivation to stop using alcohol and drugs. Integrated treatments are effective at reducing alcohol and drug use, preventing relapse, and keeping individuals in treatment longer. These interventions can be delivered either one-on-one or in a group format. I want to talk about employment next. Research shows that about 70% of adults with severe mental illness, such as bipolar disorder, want to work, and about 60% can be successfully employed when using an intervention called supported employment. Supported employment is designed to help people find and keep competitive work, meaning work that's in the regular workforce with the same pay as other employees receive. Key components of the intervention include a rapid job search and continued support once a person gets a job. Individuals do not receive job training prior to getting the job. Employment specialists work with people to identify their career goals and their skills. Case managers and mental health providers work closely with the employment specialists to provide support during the job seeking and the job keeping process. Lastly, I want to talk about treatment for weight gain. Weight gain is one of the most significant and frustrating side effects of many medications used to treat bipolar disorder. Weight gain can lead to problems such as diabetes and hypertension, making it a serious problem for many people. But evidence-based weight loss programs are available. These programs generally last 3 months or longer and include education about nutrition and portion control. Participants learn skills to monitor their daily food intake and their activity levels. They have regular weigh-ins, and they set realistic and attainable personal wellness goals. Participation in such programs can help prevent additional weight gain and lead to modest weight loss. The Veterans Administration has a version of this program called MOVE, which is offered in a supportive group setting. That wraps up our discussion of evidence-based psychosocial treatments for bipolar disorder. Join me next time to talk about mood stabilizers, antidepressants, and antipsychotic medications, the main classes of medications used to treat bipolar disorder.